can you please share with the audience your viewpoint and your recommendations regarding the use of cognitive behavioral therapy in this patient population?
Definitely. So we actually, if you look at our some of our guidelines, even though majority of us tend not to stick with guidelines, actually APA, when they revised their guidelines, because when they revised it was 2010. The old guidelines was actually interesting, was just about, talked about switching medication. So the new guidelines actually recommends that we can use medication, therapy, or a combination of therapy and medication. And to give it the appropriate amount of time and reassess and go back to see if you're getting a response, great. If not, reassess to see if the medication is the right choice. We've talked about that. If the patients are taking the medication, is the dosage the right amount? And look at your therapy. Is this the right kind of therapy? Is the duration of therapy appropriate? We have to optimize that. So cognitive behavioral therapy, I think, is, I describe it as aspirin of psychiatry. You cannot go wrong with utilizing cognitive behavioral therapy at any level, especially when it comes to major depression and anxiety. And major depression frequently is associated with quite a bit of anxiety symptoms. And cognitive behavioral therapy can be very helpful, helping patients to stay here and now and learn tools to work with their symptoms of catastrophizing and just distortions that are associated with it. So it can be a very effective tool.
Thank you.
Many of my patients are very keen to pursue mindfulness-based cognitive therapy as well. And so do you see some of the same benefits in mindfulness-based cognitive therapy as well as traditional CBT?
Exactly. I think it's really important to teach them to be here and now. Again, I treat a large number of patients with substance abuse issues. And mindfulness is one of our mainstay in our program to teach them to stay here and now.